It is New Year's Eve. Your boy has been contracted out to do a night shift. There is literally no worse day to be doing a night shift, but your boy is doing it. I'll be looking after 9 wards and about 280 patients. So that's quite a lot. I'm going to be on call on site, and I'm going to take you guys along with me. So I'm going to be answering questions about night shifts, talking you guys through what happens, who's there, what kind of jobs we do as newly qualified doctors on the ward, where there's not many people around and there's a lot more responsibilities. But before we get to that, I want you guys to see this. So my graduation certificates just came in the mail, and this one is my management degree from the Imperial Business School, and this one is my medical degree from Imperial as well. So I don't know, just look at that. It's so sexy. I just love it. Just looking at those two just makes me smile, and it's the little things. It's the little things. So these are the scrubs I'm going to be wearing tonight. These were sent out to me by a company called Scrubs, so shout out to them. And I have made a unsponsored review of like 4 different scrub companies. So if you're looking out for any kind of scrubs, then go check that out. And there's discount codes as well. Got my Huel, and let's grab a couple of protein bars. And cannot forget the Magic Mind as well. We just had handover, finished at 9:30, and I came down to make a coffee, and I was in the midst of taking a sip, and then suddenly the crash call went out. So someone had a cardiac arrest, and I was contemplating whether to even talk about this, but I think it's important that you guys know everything about what goes on really. And so cardiac arrest, if you guys don't know, is when the heart stops beating. And so I had a bleep over here, this thing, and the bleep started ringing. On cardiac arrest, there's the whole team, so there's a lot of senior doctors, obviously with their own caseloads, but everyone comes together for the cardiac arrest, and I'm the most junior of doctors in the cardiac arrest, so I just try and help wherever I can, whether that's by doing CPR, whether that's by taking bloods, listening to the chest, which I all did today, and unfortunately the patient did pass away, so that's the reality of things. And yeah, it's straight into, you finished handover, literally having a coffee, and bam, first thing that happens is that. So, and that's kind of it. Then you move on to your jobs. I'm back here with the bleep answering. After that cardiac arrest, I was bleeped for this patient who was in urinary retention. So essentially, they have prostatic cancer, and so their prostate's really big, and that's blocking the urethra, and so they can't pee, and because of that their bladder swells up and they're unable to pass urine. They're in a lot of pain, and they told me that this other clinician has already had a go and they were unable to get the catheter in. A catheter will allow the urine to pass, and they couldn't do it because the prostate was so big it just wouldn't go through. So they called me, and your boy rocked up, and I got the catheter in, and it was an instant relief for the patient. And I think that's one of those things where it's very rewarding to be a doctor, because you can see immediately the patient feels so much better right after that intervention, which is mad, because they were literally gripping the sheets. Okay, so I was bleeped a few more times, and I wrote down all my jobs on my trusty couple pieces of paper. Normally I use my iPad, but stupidly enough, today of all days, I forgot my iPad. It's now 11:46, it's almost New Year's Day, so I'm gonna head upstairs with the rest of the team. So, New Year now.
Oh yeah.
2024. Very sad.
It's sad or funny?
Oh no, as in us being here, it's just sad. Like
this is gonna be our longest shift that we could ever have. The longest.
We can make that joke where it's like, a 1 year long shift. Been working since 2020.
But still,
A lot has happened in the past 2 hours since New Year's. It's 2 o'clock right now. And number one, so there was a patient who was very fluid overloaded. So we're talking her arms and her legs were very, very thick. And to the point where you would squeeze it and it would leak water. Like water would just be coming out of the skin. and she had low sodium, and so we needed to do some bloods to find out her exact sodium level and then manage that. Taking bloods for someone like that when they're so swollen is so difficult, but then I called my reg, and then the reg was like, just do an ABG instead. And an ABG is where you take bloods but from an artery. I was like, don't worry about it, don't worry about it. Next thing you know, I got the ABG done, which was mad. So that was a nice little win for me, personal victory. Another patient was complaining of another opening by the anus, and so I had to go examine, and then based on what I saw, then make a referral to the surgical department. I'm going to answer some of your questions and also eat this. What times do you eat when you're on a night shift? So this varies completely. It depends on how busy your night shift is and when you want to eat. There's no set timings. In the NHS, doctors don't really have a staff room. It's really weird. So the nurses and other staff, they have the staff room on the wards, but doctors don't. They have something called the doctor's mess, which is a staff room for doctors, and they have to actually pay to use that staff room, which is annoying. So I pay £10 per month to access this staff room. So yeah, I've got a few things. I'm getting bleeped. So my bleep just went off for an extension 3847, so I'm just going to go give them a ring. Hi there, it's Deb, the duty doctor 099. I was bleeped. The reason I was creasing was because she basically said good morning, good afternoon, good evening. Okay, and they were admitted with UTI and currently been managed. Okay, what's the news? Yeah, I'll take a look. Thanks, bye. Okay, so this one was a bit more simple. Patient is basically admitted with a UTI, urinary tract infection, and they need some paracetamol prescribing because they are spiking temperatures. So I'm going to do that right now. Okay, so time to answer some of your questions. I've asked on Instagram, so I've got quite a lot. The first question is, what's the difference between a normal night shift and an on-call night shift? And for most doctors, there is no difference. On a night shift, because there are less doctors, you tend to cover more wards. So you're on site and you're covering more wards as a junior doctor. Junior doctor is anyone who has finished med school, so me, all the way up until you become a GP or a consultant. So someone who's worked for 10 years is still technically a junior doctor, which isn't a good terminology because there's no consultant on site basically. I'm not sure about emergency department, but generically there's no consultant in the hospital. So these junior doctors are handling everything pretty much on their own, unless they need to give a consultant a ring, which isn't that often at all. I'm responsible for 9 wards and about 280 patients. Anything that happens on those wards, nurse bleeds me, and I'm the first point of call to handle any of those complaints, any deteriorating patients. You are expected to manage everything on your own unless it's something that you think is quite serious and needs senior input. You do have a registrar who's also technically a junior doctor, but much senior than me, and that's why the junior doctor naming terminology is stupid. And so they've got their own caseload managing their own patients, but if you need, they're on call. You can give them a message or ring, and they can come help you out. But relatively speaking, you are supposed to handle as much as you can on your own. Next question is, do you get a higher pay rate working as a junior doctor on nights? So you do. As a junior doctor, you get a 37% enhancement on the hours that you work between 9 p.m. and 7 a.m. So I normally earn £15 an hour. On a night shift, I would get about £21 per hour. And this is crazy, guys. I made a video on this on TikTok and it got 200k views in like a couple of days. But essentially, doctors are the poorest paid staff out of all NHS staff on Christmas or bank holidays or New Year's Day, which is crazy because doctors don't get any enhancements. So they just get paid their base rate. Essentially, even band 2 staff, so porters, housekeeping staff, cleaners, they get paid about £21 per hour on Christmas Day, whereas doctors get their base rate, so £15 an hour for an F1. Do you like the increased independence? I do. Obviously, it's very intimidating and scary, but you're able to do stuff and feel like an actual doctor, which is great. I do have a lot of support, obviously, from my seniors. So I have an SHO, who's a doctor who is 1 year above me, or maybe 2 years. I can contact them, and I've also got a registrar I can contact, and they're very nice, so they can help me out. Oh, so it's now, I think it's like 8:30. I don't know when I last spoke to you guys. It was like, what, 2 o'clock or something. We haven't rested since then. I've been on and on the run basically since that break. I was eating my food, got interrupted, and loads of sick patients, and a lot happened. There was 2 cardiac arrests. Actually, no, there was 3. I can't remember what one of them was, but 2 of them I remember distinctly. One was the 16-year-old who was stabbed in the neck and then stabbed multiple times to the abdomen. Came in and then had a cardiac arrest. Then there was another stabbing on New Year's Eve, man, on New Year's Day as well. Like, that's crazy. And this person was just standing outside his flat, and someone walked up, sliced his neck open, and it was completely like open out wide. But luckily, the patient was a bit overweight, and it didn't actually, because of that fat, it was protective. So even though half their neck was literally open, it didn't cut like many major vessels. Only I think 1 vessel was cut, and so currently I think they're stable. I'm getting a bleep. I was worried that's another cardiac arrest. I'm gonna answer this in a sec, but so yeah, that happened. And then there was another patient that I was dealing with who had a slightly low BP, and so I was just going to give some fluids, but then they started musing very high, and so I went to see them. They had a lot of tenderness in their tummy, so I was thinking, okay, UTI, but because her blood pressure was dropping, her heart rate was dropping, so then I was thinking, okay, maybe we're thinking sepsis here. Did a full sepsis screen, contacted the reg as well, reviewed her together, and basically, like, she was very, very unwell. Family had to come in. I had to update the family, which was, breaking the news to them about what's going on. So that was kind of, and obviously they have a lot of questions, and so that was an experience too. And then we did an X-ray on her, and it came back, and her lungs were really completely, basically gone. And so there's one thing left for her, which is a type of ventilation. So we're just waiting to see now if that will work. If not, we have updated the family that she is likely to pass away. So yeah, that was another patient I was dealing with for a while. Then there were 2 other deaths, and I had to go certify those deaths. Can barely speak now. So there were 2 deaths. I had to go certify it, which basically just needs a doctor to basically do a few of the checks, like checking the reflexes, listening to the chest, things like that, just to make sure that the patient is in fact dead. The shift is basically over, so I'm going to hand over now. But yeah, it's been 13 hours of a shift. Crazy shift. That's the life of what kind of goes on here.